Okay, we're gonna start again. I'm gonna go back and check her cranial nerve number 8, which is the acoustic. I'm gonna ask you to cover one ear. I'm gonna whisper a word in this ear. Can you just tell it back? Baseball. Okay, I'm gonna do the other ear. Basketball. All right, perfect. Okay, so next I'm gonna move to the mouth. I'm just inspecting the mouth. The lips are nice and pink, no cracks noted. I'm gonna look inside your mouth. I'm gonna check your teeth, your gums. Okay, I'm gonna look in the back of your throat, your hard and soft palate. Buccal mucosa is good, tongue looks good. Okay, I'm gonna start by checking cranial nerve number 9, which is your glossopharyngeal. Could you swallow for me, please? Okay, then I'm gonna check number 10, which is your vagus. I'm gonna ask you to open your mouth real wide and say ah. Perfect. And then number 12, which is your hypoglossal. Could you stick your tongue out? And can you move it side to side? Okay, and then can you stick your tongue to there you go, against each cheek. Perfect. All right. And then I am going to move on. I'm going to check your temporal artery. Okay, it's good. I'm going to move here. I'm going to check cranial nerve number 5, which is your trigeminal. Can you open your mouth for me and shut it? Perfect. And can you clench your teeth down? Perfect. All right, good. Next, I'm going to move to, I'm going to check some of your lymph nodes. I'm going to name them as I go. Okay? All right, so this is your pre-auricular, post-auricular, your tonsillar, your submandibular, submental, your posterior cervical chain, your anterior cervical chain, and then can you roll your shoulders up a little bit? I'm going to look at your supraclavicular. All right, I don't feel any swollen or enlarged lymph nodes, so that's great. All right, next I'm going to look at your trachea. It's nice and midline. I'm going to check your carotid. I'm going to put my fingers here, just check for a second. Okay, good. Good, and I don't know what to do with my stethoscope. Okay. All right. And then I'm going to listen. Oh, I'm sorry. Can you take a big deep breath, blow it out, and hold? Perfect. And again on the other side. Okay, good. All right, and let me go right. I think I did all that. Okay, now I'm gonna ask you to turn. I'm gonna go from the back. I'm gonna try to feel your thyroid. Can you see? All right, and can you tilt your head kind of like this to the side? Show me if I can feel. Okay, and the other side. All right, good. It's not palpable, so that's good. Can you see good? Okay, next I am going to inspect your posterior thorax, checking your scapula. Everything looks good. I am first going to inspect. I'm going to palpate here. Let me know if you have any tenderness. Okay, good. Next, I'm going to listen. If you could just roll your shoulders up a little bit again. Roll them to the front. Right, perfect. I'm just going to move side to side, listen. Take big deep breaths. All right, perfect. Okay, and I'm going to ask you to turn back around. Okay, I'm going to do the same thing on the anterior thorax here. I'm inspecting again. I'm looking at AP to T, which is 2 to 1, so that's good. I'm going to inspect. Doesn't look like she's using any accessory muscles to breathe. Respiratory rate is normal. I'm going to listen one more time. Well, first I'm going to feel if you have any tenderness, let me know. Any tenderness there? Okay, and I'm going to listen now. Same thing again, several different spots. Can you see these? Okay, everything sounds good. Next, I'm going to move on to your heart. Same thing again, I'm going to be listening in several different spots. I'm going to name them as I go. It might take a little bit of time. Nothing's wrong. Okay. All right, so I'm going to start here. I'm going to listen to the aortic, the pulmonic, Erb's point, tricuspid, mitral. Okay, I'm going to flip it over. I'm going to listen with the bell to the aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, good. And I'm checking. I don't see any pulsations or anything like that, so it's great. All right. And next, I'm going to ask you to lie down. I'm going to listen to your heart again while you're lying. Okay. All right. Once again, we're going to listen to the aortic, the pulmonic, Erb's point, tricuspid, and mitral. And again with the bell, aortic, pulmonic, Erb's point, tricuspid, and mitral. And can you roll a little bit to your left side? Okay, perfect. And then I'm going to show you with my finger where the apical impulse will be, which is the fifth intercostal space, mid-clavicular line. Okay. All right. Next, we're going to move on to look at your abdomen, your stomach. Okay. First, I'm going to just assess our skin. No striae, no bruises, anything like that noted. The skin looks nice and warm. I'm going to get down at an eye level. The stomach looks nice and flat. I don't see any paracellus or anything like that going on. First, I'm going to listen to her stomach, to your bowel sounds. I'm just going to listen in several different spots. Okay, good. And then next, I'm going to percuss. Okay. And then next, I'm going to do some light palpation. If you have any tenderness or pain, just let me know and I'll stop, okay? Just feeling around. I don't feel any masses. Everything feels good. Okay, I'm going to go a little bit deeper. If it hurts, just let me know. Any pain there? All right, great. All right, your stomach looks good. Next, I'm going to move down to her lower extremities, okay? Just going to assess them. Skin looks good. They are nice and symmetrical. Hair distribution really isn't there. But skin looks great. I'm going to start by checking her femoral artery, which is here, and then her popliteal, her posterior tibial, and then her dorsalis pedis. Okay, looks good. And then I'm going to check some of your range of motion. If you could lift your leg, lift your knee up, and then bring it to your chest, and then move it over to the side. Okay, good, great. You can put it back down, and let's check this one. Same thing, bring it to your chest and over. Perfect. All right. Gonna check some of your muscular strength here. All right. You could push up. Okay. Push down. All right. Push in, and then push out. Okay, great. I'm gonna check your feet. Same thing. When you push in, push out. Okay. Push against it. All right, good. Check a little range of motion in your feet also. If you could just move your ankles around and then wiggle your toes real good. Perfect. All right, good. So lower extremities look good. Everything went well there. And next, I am going to ask you to sit up. I'm going to check your reflex here, your patellar reflex. Usually I do it with a little tool, but I don't have one of those today. So I'm just going to use the end of my stethoscope, all right? Just relax your legs as much as you can, and I'm going to hit it. All right, perfect, and then this one. Perfect, all right. And then if you could stand up. All right, and can you turn this way? All right. Next I'm gonna be doing a scoliosis screen. I'm gonna be checking the 5 places here, which is the shoulders, the scapula. I'm gonna be checking the elbow gap here, iliac crest, and gluteal fold. And then, could you bend over for me? And I'm just gonna be looking, making sure that your spine is nice and straight, and it is perfect. All right. Okay, ma'am, we can have a seat. And I think that will conclude our video for today. Thank you for being such a good patient.